So your question was for the older children
Yes.
of cerebral palsy. And you are talking about the meningitis also.
Okay. Yes.
Actually, there are several etiologies of the cerebral palsy. It is a broader spectrum motor disability caused by the brain damage. Although these are the non-progressive, but children develop according to their age, right? So the etiology, meningitis is one of the cause. That is called neonatal meningitis. That is the postnatal causes.
Yeah.
The prenatal, we can divide it into mainly the viral infection that is very much common in India. That is rubella virus and the cytomegalovirus. These two viruses are very much common, which infect the uterus and cause cerebral palsy. In early age, in a prenatal causes, during the pregnancy, we can categorize into the three parts, that is prenatal, natal and postnatal. In a prenatal, that is the viral infection. Two viruses, rubella and cytomegalovirus. Cytomegalovirus.
Okay.
The two viruses are very much common. Hypoglycemia is only another cause. Direct trauma in the abdomen, right? But the birth trauma during the natal period is very much common in India.
Yeah.
That is breech presentation of the child. And take the birth through their legs, there is chances of hypoxia. Breech presentation is very much common. But with the help of the government of India, the state government are very much aware among the children malnutrition and to prevent the death risk. They do the ultrasound scan. That was very much common. That is very much common in India. In early detection, during the pregnancy, we do the ultrasound scan and we just diagnose that the child is in a breech presentation. We plan for the elective surgery.
Cesarean.
Cesarean.
Yeah.
That is for elective surgery. The planned surgery. Not that the child are in the birth canal and in the hypoxic condition and in a panic situation we decide for surgery. That is not. That is elective surgery. That is planned surgery. My child is at the breech presentation, they need cesarean.
Yeah, 3 of them.
Very less due to the awareness program that I was talking previously. The prevention of disability, which can is possible. So the breech presentation that can be prevented. Another thing, metal causes इसमें forceps delivery. Forceps delivery is very much common by the injury of their head, damage of the tentorium layer of the brain, and cause this cerebral palsy. That is very much common in the rural area also. The parents are angry that I have need the normal delivery. And by the using of the forceps, there is a damage of the head, mainly the tentorium layer of brain, and cause the cerebral palsy. That was very much common. But it is very less number because the neonatal jaundice, conjugated and unconjugated serum bilirubin. So conjugated bilirubin is very much common. Every children have the jaundice after the birth. They need the sun bath and it will be happens. That is for circulatory jaundice. That is very much common. Due to the conjugated serum bilirubin have been increased. Everybody knows in the jaundice bilirubin will be increased. But bilirubin is two types, conjugated and unconjugated. When there is unconjugated serum bilirubin is raised, that is a very direct conditions. The need phototherapy and cause the acute type of cerebral palsy. That was also common. But in this way, we are able to, the government is able to aware this and cause this cerebral palsy.
That's the case with the boy that's in your
Neonatal meningitis, the fever of the brain. This is a very bigger cause.
But even in this 19-year-old who had this...
I'm treating. I'm coming on your points.
Okay.
I'm coming in your points. So we see the rehabilitation in a different phases. Suppose the child come early, diagnosed early, is diagnosed early, then we rehabilitate according to their needs for their mainstreaming. Suppose he come after the 5 to 6 years. Our plan is totally different. He comes after the adult age, 15 years, 19 years, then the mode of the rehabilitation has been totally changed. Because there is no benefit with the rehabilitations. When there is medical rehabilitation, we cannot treat the patient. We cannot treat the child at a later age. But we minimize, suppose that our plan is in a different mode. Suppose he have the tightening in their hand.
Yeah.
He is unable to eat with their arm. Okay. So with the help of physiotherapy, if there is a possibility, if there is a contraction, we can minimize their tightening and he able to eat with their hand. That is functional rehabilitation program. Suppose there are barriers in their feet. He walks but he not walk properly. They will provide the stick to relieve the contraction. But we cannot think for their whole medical rehabilitations up to the 100%. Since they are less to minimize. Suppose any work, any things who make the barrier, who create the difficulty to do their functional ability for their ADL. Any things, any tightening, any contraction which create the barrier for their ADL, we minimize these things. That is the medical rehabilitation. But not only by the physical therapy, that is also by the surgical intervention sometimes in cerebral palsy cases. Because cerebral palsy are the three types mainly, the spastic, flaccid, and dystonic chorioarthrosis types. In a spastic children, he had the severe deformity, contraction of his knee, both knee, unable to straight his leg, unable to wear any kind of the orthotics. Suppose he are not able to walk properly. I want to give him a HKF, hip, knee, ankle, foot orthosis for their walking pattern. But his knee is totally flax and contracted, or the deformed, unable to straight. Then how he will wear the HKF orthotics? So we take the help of a orthopedic surgeon or a PMR, physical medicine rehabilitation department for their surgical intervention to lose the tightened tendons or to cut the tendons with the help of the surgeons. So that is also covered under the Nirvana scheme.
There's the girl that we saw that couldn't walk. You remember she was on her knees, and it's probably as well through tightness, not just the CP. It's because they never move.
So according to this. So we plan what type of surgery, what type of therapy are helpful for him for their rehabilitation program. Who build the creations, who create the obstruction for his ADL or the functionality only. We will think about on the behalf of this one. Another part that is called social rehabilitation program. Think about the social rehabilitation program have a large up to 100%. But I totally agree. She doesn't need any kind of the physiotherapy. She needs the social rehabilitations. Her age was of 14 years. We have planned for their rehabilitation program, and could you believe after 2 or 3 years, she has won the 3 gold medal in National Paralympics in the running, in 100 meters. Because we have been planned for not for their medical rehabilitation program. We have been planned for their social rehabilitation program. And she is doing the government job right now. Because in the reservation category, I have already told that it has increased 3 to 4%. In the 4% itself, there is a sports quota reserved for the cerebral palsy conditions also. So these all are the social rehabilitation programs. So you are thinking about the child when he is 19-year-old. So you should not think about a medical rehabilitation program. You should think about the social rehabilitation program. In a medical rehabilitation program, we can do only make him easier for their creating the obstruction and for their ADL and functionality. Have you any kind of a video or something else? And a photograph of the child?
Okay, so the 2 older children, we have a video of one of them. Riva, so there's two children I'm thinking, the older ones. One is a girl who is, I think it's autism, could be CP, co-condition, epilepsy. She's not being treated for epilepsy, she's having many fits in one day, and she has no treatment.
Next one day we are going to
इनका कंप्लीट हो जाएगा फिर यहाँ यूके चले जाएंगे फिर
हाँ नहीं फिर वापस आएंगे अप्रैल में
So you are doing PhD.
Yeah.
University name?
Amrita Vishwa Vidyapeetham.
Amrita Vishwa
अच्छा अमृता विश्वविद्यालय. अमृता विश्वविद्यालय यहाँ के साथ.
You know Amma?
नहीं केरल
Kerala.
very
He is
famous.
in this discipline that is